Hello, everyone. I'm Cheryl Stroud, Executive Director of the One Health Commission, and I'm thrilled to share some information with you about One Health for human health clinicians. So to get going here, in the way of disclosures, I disclose that I do work for this nonprofit organization. It's headquartered in North Carolina, but working globally to really help the world understand and fully implement One Health. We have no affiliations with any commercial products, and there are no corporate or commercial representation on our board. We do accept donations from corporate sponsors from time to time. What I'd like to do in this time that we have together is really help us understand the full scope of One Health. Share some examples of cross-professional collaborations and why they're so important, especially to our human health colleagues. So thank you very much for the opportunity. Objectives will define the term One Health. There are a lot of ways to think about this. I really just want us to all understand the importance of the interconnections and why we need to climb out of our silos. You should be able to give several examples of arenas or issues that are in need of a One Health approach, because there are so many of them. And then I would expect that you would be able to list 4 or 5 or more actions that you might take as a human health clinician to really fully implement One Health thinking in your own daily practice and work life. So one of the take-home messages that I would like to share with you is that no one profession can know everything. And these collaborations that we're desperately needing across professions and across disciplines are not just magically going to happen in our current systems. They're going to start with relationships, which are also not just magically going to happen if we stay in our little clinics and our labs and don't really venture out and create those relationships. So I hope that you'll understand by the end and have some ideas of how you can really enrich your own practice and your own understanding by trying to reach across the professions. So what is One Health? Well, there are a lot of definitions. It's really a concept. It's an approach that recognizes the health of people, animals, and the environment are inextricably interconnected. We've known that this is an ancient concept. It's not a new concept. Recently, a One Health high-level expert panel that was put together by the United Nations has come up with a little more complicated definition that I won't read to you out loud here. If you want to pause and look at it yourself, it's really basically this whole idea of trying to focus on the interconnectedness and to realize that eco-health, ecosystem health, the health of every living creature, the biodiversity is all very important to the health of the humans. And so we need to focus not just on the humans. So this concept is not new. It's a concept. We're actually trying to resurrect it. Many indigenous societies have this kind of grounded in their DNA. This taking care of the natural world, of all the animals, realizing before they had the words for it that biodiversity and the value of every living creature, from the smallest amoeba to the largest mammal, lends itself to the health of all. So that's an underlying concept. And back in 400 BC, Hippocrates was talking about airs, waters, and places. And more recently, in the 1880s, Rudolf Virchow in the One Health world, this is a very famous quote, that between animal and human medicine, there are no dividing lines, nor should there be. And he's actually considered the father of cellular pathology. So I really hope that we can find ways to join hands as healthcare professionals, whether we're doing public health or veterinary health or we're human health or even ecosystem health, environmental health. We all need to be joining hands and realizing we're really working together. Unfortunately, we as humans have a tendency to think that we're the most important species, the top of the food chain. Everything is here for us to use however we think we want to. And that has led us to a lot of destruction of our environment, forgetting that we're just part of an ecological continuum. We're just part of the biodiversity, and that it all has to be treasured and valued and protected, that for the health of us all. There's so many publications coming out now about how biodiversity really protects the health of humans as well as animals. So this conversation about One Health actually originated using the terms in this most recent concept of One Health in the late 90s, coming out of the conservation and biodiversity sectors who were pointing out and saying, oh my gosh, look at all these diseases that people get that come from animals. And so you can look at some of the titles here. That was kind of the early part of the resurrection of this conversation that we now call One Health. We didn't really start using the words One Health until the early 2000s. But many people, and actually it was zoonotic diseases that really brought this concept to the forefront again. Starting back in the early 2000s with avian influenza. Some of you may remember the first, and some of you may remember the first SARS back in 2003. That luckily didn't become a pandemic like we're experiencing right now. And I know I don't have to tell this audience, but many people don't realize that HIV/AIDS started as a zoonotic disease. In fact, many people in the general public don't even know what the term zoonotic disease is. So I often remind or tell people in my presentations that a zoonotic disease is a disease that passes back and forth between people and animals. And of course, we've seen Nipah and Zika and Ebola, and now we're living with SARS coronavirus 2, COVID-19. So yes, it was zoonotic diseases that really brought us to an awareness where we started looking around and realizing we need to join hands across professions, because any one profession does not have the answer. And there are many zoonotic diseases, obviously, today that are still a major part of this One Health conversation. For example, in India, we will never control human tuberculosis until we've controlled bovine tuberculosis. There are so many incredibly important zoonotic situations that we need to be working on, but that's not all One Health is about. What we have realized over the past 15 or 20 years is that there are so many arenas, so many topics, so many issues that we're dealing with that are begging for this One Health approach. Animals as sentinels for things that we're exposed to in our environment. Antimicrobial resistance, a huge One Health topic. The biodiversity we've touched on, climate change and our impact on that. Comparative biology, comparative medicine, translational research, disaster preparedness, civil society, complex systems, food and water safety, a huge need for us to work across professions. The human-animal bond, we're going to just touch on a lot of these. We're going to do kind of like skimming a rock off the top of the water to just really kind of highlight some of the many arenas that are really begging for this. And vector-borne diseases is kind of like zoonotic diseases. It's another of those arenas that really are very important in this conversation. So why do we need this One Health conversation? Because our systems have forced us into silos and really don't give us many opportunities to really interact across professions. I, as a veterinarian, only time I ever get to interact with a human health provider is if I'm sick and I go to my doctor. We don't get to attend each other's conferences. We can't even read each other's journals because they're behind paywalls. So our systems have kind of forced this. And it also started when we started separating out, back many years ago. You just went to university and you learned whether it was animal medicine or human medicine, it was all taught together. And then we separated out, veterinary medicine, public health, human health. And so that pushed us into silos. Our academic tenure processes don't always value trans-professional interactions when you're writing grants and getting grants and writing papers, because if you don't publish in the most elite journal for your particular area, you don't get quite as many brownie points. And so that's another problem. Government agencies, while our government agencies are very much in silos, industry research is very much proprietary. It's not really open or shared. Our publication systems, really, this has been a major one. So this one really is, this one gets me, because most of our research is done with public dollars, with tax dollars, but the results of the research often gets published almost always, until open access has really come along a little bit now, got published in journals that are owned by professional associations, and only members of those professional associations have ready access to that research data, that research information. And then, of course, there are simple, silly little things like language barriers in each of our professions. We develop different acronyms, and especially the older of us in these professions, are very intimidated to go talk to somebody in another profession who might use an acronym that we're not familiar with. And we don't want to look stupid saying, oh, I'm sorry, what are you saying? So there are many reasons that we really need to open these conversations across professions. And I'm hoping by the time we get through this hour that you'll have a better understanding of some of those and how you can offset and reach through them. So let's start skimming that stone. Animals as sentinels. Here's just an example. Back in the 80s, we started introducing polybrominated diphenyl ethers into our environment as flame retardants. We were even putting them in children's pajamas and all the fabrics and upholsteries and carpets and hard plastics like in our computers. And back in those days, it was the old computer towers. And some smart person realized that in the 80s, late 80s, we also started diagnosing hyperthyroid cats in the veterinary world. And, you know, we had never really seen very many hyperthyroid cats. And somebody realized there might be an association. Somebody at NIEHS actually did this work, some of my colleagues over there. And they found a very, very strong association with when the polybrominated diphenyl ethers, PBDEs, were introduced into the environment and when we started seeing hyperthyroid cats. Well, it turns out those PBDEs are very powerful endocrine disruptors. And our cats were telling us this because they would sit around on these surfaces that would outgas, those PBDEs would outgas in the dust and get on the cats. Of course, cats sit around grooming, and they were getting very high levels of these PBDEs. We have since stopped putting those PBDEs in children's pajamas. We're even wondering if because we have had studies also recognize that you could find these PBDEs in the blood of toddlers. We've stopped putting those things in our environment, but I'm sure a lot of them are still there. And it's even been postulated that this could be playing a role in the childhood obesity epidemic that we're seeing. So this is just an example of how our animals, we live in the same environments, we share the same environments, and our animals, our companion animals in this case, were kind of showing us what could be going on in our environment. A very similar story happened with the perfluoroalkyl substances, PFAS. Many of you may be familiar and realize that CDC has now been studying PFAS and has found it everywhere. And it's also a very powerful endocrine disruptor and has been put in so many. We were putting it in the coating surfaces, the nonstick coating surfaces on our frying pans, for heaven's sakes. So let's pay attention to how these animals that we're living with in our environment could be sentinels of what we're all being exposed to, the animals and us. This just happens to be a dog that's getting a blood test drawn back when the Flint, Michigan water crisis was going on. They were looking for heavy metals, lead and copper and mercury and zinc, and the dogs, have to get some clue of what the children and the people in that environment might have been exposed to. So we'll visit this again later. And then I love to teach One Health with stories, and I hope that you might take a moment to go and listen to this little YouTube video. Tracy McNamara has done this. She's my colleague, a veterinary colleague who was at the Bronx Zoo as a veterinary pathologist back in 1999 when West Nile hit this country. And as you recall, back in 1999, there were people dying of neurologic issues, and there were crows falling out of the sky dead. And she was at the zoo, and she realized that, CDC thought it was St. Louis encephalitis that was killing the people. And when she saw that some of the birds at the zoo that should have been dying if it was St. Louis encephalitis were not dying and others were dying, she took some of her, and she saw when she did necropsies, we call it in veterinary medicine, or autopsies on these birds, she found these horribly inflamed encephalitis processes going on. And she really wondered, well, could there be a connection with the people we're seeing dying right now in New York and these birds that we're seeing dying? And so she ended up sending some samples to an Army lab, and because she was very suspicious, and CDC thought that they had it figured out. And so the Army lab came back with her bird samples and said, you're right, this is not St. Louis encephalitis, this is West Nile. And as the story evolved, it turned out that was West Nile. It's now obviously across the US. But she's making a really good point, and I hope that many of us will think about it, is if we're not paying attention to what's going on with the animals around us and paying attention to what disease processes they could be experiencing that could be passed to us, then we're missing the opportunity. And instead of using animals as sentinels, we're using our taxpayers, our humans as sentinels for what we might be exposed to. Some of you may notice the diamond that's floating in the back of many of my my slides. I forgot to mention that I really see One Health kind of as a diamond. And all these different arenas that we are going to talk about, including vector-borne diseases, it's just like one of the cut faces of the diamond. There's so many facets or aspects of this thing that we call One Health that makes it so incredibly valuable because it's so incredibly needed in so many areas. Another story that Tracy mentions, if you go back and look at her YouTube video, and you'll notice that I put active links in all these slides, and I'm happy to share them with Invisible as a PDF, so you can go back and grab those links if you're interested. Another story in New York back in 2017 was an influenza broke in a cat shelter. And it turned out to be zoonotic because it jumped to the people, it jumped to the veterinarians and the staff. And before they realized what was going on and figured out that it was a novel influenza that had never been seen before there in cats, it had jumped not only to the veterinarians, but they had adopted 300 animals out to 300 families in the area. So what if that had been another 1918 flu pandemic? We would not be prepared because we weren't paying attention to what's coming from the animals. And so there's a huge push now to get us in a situation where we have systems in place, biosurveillance, syndromic biosurveillance for wildlife and companion animals that we do not currently have in the United States. And it's very similar in other parts of the world. So as a stark reminder, as diseases can travel around the world so quickly and so easily these days, that we need to find ways to not be using taxpayers as sentinels and not be figuring this out only when we have bodies in the morgue, which is what we've been experiencing for the past 2 years. Antimicrobial resistance is a quintessential One Health issue. I just want to make you aware of a little book that a colleague of mine wrote, One Health and the Politics of Antimicrobial Resistance. One of the points that she has pointed out after spending 5 years researching this is that we share our environments, not only our environment, we share our microbiomes with those we live in, our gut flora, our skin flora, and nobody was watching to what antimicrobial resistant pathogens or organisms might be, that our pets might be harboring. And sometimes we're passing them to the pets. So we were missing that piece of the picture. We were not really paying attention to these antimicrobial resistant organisms, not always pathogens, but microscopic organisms, because it's not just bacteria. We're also seeing issues with fungus now with antimicrobial resistance. And realizing that we live in a shared environment and paying attention to what's going on in the animals can really inform us for also the human health. And realizing that things like MRSA can be zoonotic infections and can pass back and forth. So little foreshadowing here, ringing of a bell. If you're a clinician, you definitely need to have on your patient intake forms questions about, do you have pets? Do you work with animals? What is your exposure to animals? So that you can have in your rule out list the things that might pop to mind if there are animals or pets in the environment, because they're so wonderful for us, excellent for our health. And we're seeing antimicrobial resistant organisms now in marine mammals in the middle of the ocean. They've never been given antibiotics, but our environment, the antimicrobials, the residues that are getting washed into the environment, the residues and the antimicrobial resistant organisms that are getting washed into the environment in the feces, in those organisms in the feces that have developed resistance. And now that all of these organisms, these bacteria, they're in the waterways that are getting washed into our oceans, and all those bacteria are exchanging their little resistance cassettes on their DNA in their genome, and so it's becoming, as you guys are all aware, it's a huge issue, and the only way we can really address it is to join hands across all professions. not just animal health and human health, but environmental health, all aspects of ecosystem health. Until a few years ago that not only do we have intensive farming of cows and pigs and chickens, but we also do intensive farming for fish. And they also use a lot of antibiotics that get dumped into our waterways and our environment. So I think we're going to have to rethink some of our systems. We even use antibiotics in our agricultural systems, very much so in citrus, and I'm sure it's very needed. I'm not begrudging the fact that we need to use it. I just hope that we are paying attention to how it might be affecting the environment. How long do these things stay in the environment? What's it doing to the microbiome of the environment? And what is that doing then? How is that going to circle back later and cause us problems? So, we really need to be thinking holistically and in a big picture, and definitely across professions. For example, who would have thought that we as healthcare providers need to realize that there is a microbiome to the soil, and it's incredibly important for the nutrient uptake for the plant root systems and the rhizomes of the plant roots. So there's actually a soils and human health book, and we now realize that healthy soils, healthy plants, healthy animals, healthy people, and that the gut, the soil microbiome is as important as our gut microbiome. And so, you and I, as veterinary practitioner and human health practitioners, we don't have the know-how to make sure our soils are healthy. And that takes the agricultural and horticultural sectors. So, oh my goodness, we're just really needing to be paying attention to all of these different aspects. And by the way, just a little aside on the antimicrobial resistance front, because one of the things One Health does is it starts realizing all the gaps that we have. A few years ago, some colleagues pointed out to me that because antimicrobial resistance has become a global issue, we really need standardized testing methods to be able to compare what's going on in Sri Lanka and Canada and South Africa on the antimicrobial resistance front, but we don't have standardized testing protocols. There's a different auger or a different protocol or different incubation protocol. So we really do need to start trying to standardize those testing, those antimicrobial susceptibility testing procedures around the world. Otherwise, we really don't have a way of evaluating. We might be comparing apples to oranges when we're looking at things that are happening from country to country for antimicrobial resistance. Just a little aside, let's skim on now to comparative biology, translational research, comparative medicine, whatever you want to refer it. Some of you may actually be working in areas where this is significant, especially if you're working in cancer. There's a lot going on in comparative oncology right now. So a lot of people don't realize that animals get some of the same exact cancers that humans do. Glioblastoma multiforme is exactly the same in dogs as it is in humans. And if we can just find some of these naturally occurring cancers in dogs and do the research there, because we can do it better in animals, easier. We can't kill people and look at their brains. That we can actually learn things that can help both the animal world and the humans, so that we can work together on that problem. And there are a number of things going on in this comparative medicine and translational research. Things that they're kind of off the wall. They're training dogs to sniff out ovarian cancer. Not that dogs are going to go around sniffing women, but if we can find what it is that the dogs can sniff in the urine of women with ovarian cancer, and then find that particular aromatized compound that the dog's incredible sense of smell is able to pick up, and isolate that and then develop the technology to detect that, we might be able to find a way to find ovarian cancer early, because it's such an incredible silent killer. So just tickling your thought processes here as to some of the things that we can do across professions when we really set our minds to being open to thinking that way. So many things like coming up with these prosthetic limbs for dogs, and we've learned from the human world and the veterinary world for years, but it hasn't always gone so much the other way. And so I would just like to mention to you my colleagues, Barbara Nettison-Horwitz, an MD cardiologist, and Catherine Bowers, who back in 2012 wrote a wonderful little book called Zoobiquity. And it's a wonderful story how Barbara had gone to consult as a human cardiologist on some primate cardiology cases in San Diego. And then she started looking around and realizing, working with the veterinarians there, all these disease processes that she didn't realize that animals got, that she saw in human medicine. And, she realized that a lot of her MD colleagues didn't realize, wait a minute, cats and dogs get diabetes and have some of the same issues. So, we're dealing with some of the same issues, but we're not always talking to each other about things that we've come up with to deal with these issues. So she wrote this book, Zoonotic, and she calls it her love letter to veterinarians, because she's trying to help her colleagues in the human health world realize that there might be things that they could learn from what the veterinary world has been doing. And so she literally started leading Zoonotic conferences where she would set up situations where veterinarians and human health practitioners could come together, usually where they could spend some time in a human hospital and in a zoo or a veterinary hospital. And they really did a lot of discussion about things that they see in their respective disciplines, to say, oh, how do you handle that? Well, this is how we've handled it. And so because it became very informative for both sides of the equation. Disaster preparedness and relief. How many times are we going to have to deal with scenes like this because a hurricane went through, or a tornado went through, or a flood went through? And maybe we shouldn't have built intensive agriculture facilities where it could flood. And what are we going to do with all these animals? What is the horrible public health significance of what's going on when you have a flood or a disaster situation like this? And to be able to think ahead of time and prepare ahead of time for these kinds of situations, we have to be getting the animal people and the human health people and the public health people all together at the same table, making the plans and putting the plans in place so that we can avoid when the disaster hits, we have to deal with the disaster so that we can try to at least control the damage and the public health challenges that we might be facing because of the disaster. And Katrina, oh my gosh, we learned such a lesson with Katrina. It's estimated that up to 300 people died because they would not leave their rooftops when the rescuers came around, because the rescuers were not prepared or able to take their animals, and they would not leave their pets on the rooftops. And so now we've learned, put these preparedness plans in place ahead of time. What are you going to do, or how are you going to rescue the animals as well as the people? Because it has a human factor as well as an animal health factor here. So, these are some very difficult lessons, and we're now starting to think about being prepared for disasters in a more holistic and a cross-professional way. And then I also want to highlight this little book for you. It's a great little read. The second edition has come out, also written by my colleague Laura Kahn, who's in charge. And the point here is, remember I said something about getting relationships in place and how the collaborations that we need are really going to start with relationships. Well, she's done a whole book talking about how metropolitan areas fare much better in a health crisis if they have gotten all these relationships in place ahead of time. Some of my colleagues, I've heard them say it's, during a health crisis is a really bad time to be exchanging business cards with somebody you need to be working closely with to manage a health crisis. So, are the public health officials going to be talking to the public, or are the other government officials going to be sharing information? So, this particular book has got so much more poignant in COVID-19. So you might want to take a peek at it. Food and water safety, oh my goodness, we're just so in need of these transprofessional, cross-professional planning and thinking for food and water safety, all the way from, being aware of the salmonella, which, backyard chicken flocks are wonderful. I love to see people doing it, but we need to be sure that they're educated how to stay safe, how to have habits that keep them safe with their backyard chickens, and be aware of the possibility of the salmonella, because some of these chicks that people get are coming from brooding operations that are producing chicks to sell to the public through, farm supply houses and co-ops, and they aren't always under very much regulation. And sometimes they get salmonella going in those flocks, and they end up going to, children, people who are buying chickens for chicks for their kids for Easter. And, of course, kids love chicks, and they're sometimes kissing on those chicks. And so, we just need to develop habits. It's wonderful to have these animals in our environment, but we need to know what the risks are, and to be educated and form habits that keep us safe. Even Campylobacter is another one that we need to be thinking of. The waterfront, we're starting to have a lot of conversations and realizing that water safety is a huge issue. There are actually some organizations that are focusing on water safety in a One Health way. So I'll just pause. I love to teach One Health with true stories. So I'm going to pause and tell you one. This one I lived. This is my little guy right here in the red shirt on the left. He was about 20 months old. This is about 30 something years ago. And he broke about 20 months of age. He broke with a horrible watery diarrhea. And we had no clue where it came from. We had some company the week before. They did live in a rural setting. And they did say something about their kids had been sick with diarrhea, but they didn't seem sick when they came to see us. We had been swimming with them. We had been to the beach with them. The kids played obviously very closely together. But whatever this was, it was incredibly contagious. My husband got it. I got it. We were so sick. We couldn't lift our heads off the pillow. So here we were trying to take care of a sick toddler. We were both sick. And this went on for 6 weeks. And it was just kind of rotating, coming and going. And, I'd gone to the pediatrician several times. The pediatrician didn't seem overly concerned, thought it was something viral that would eventually resolve. But my poor little guy was getting, dehydrated. And I was thinking, oh my goodness, we're going to end up being hospitalized. And my husband and I were both at the vet school at the time I was doing my PhD at the North Carolina Vet School. And he was on faculty there, and he took a soiled diaper into the vet school to the parasitologist. And if we were in a room together, I would love to ask for a show of hands of what you think this might be. But I have to just go ahead and tell you that what the parasitologist saw on an acid-fast stain under the microscope was Cryptosporidia. Now, this is very common in calves and in agricultural settings. We have no clue how we got it in our family. But it wasn't really on the radar for the pediatrician at that time. Now, that was in the 80s, right? So today it might be a little different because Cryptosporidia has come to the forefront. It's become a huge killer for any immunocompromised patients, especially in AIDS patients. So the point here is that had there been an immunocompromised person in our home, it could have been devastating. And the ability or the having this particular organism at that particular time on the radar for the human health provider just wasn't happening. So I guess, what is the moral of the story, and I guess you'll hear this moral of this story again, is we just have always needed really powerful ways to share information across sectors so that knowledge that's coming out of the animal world and out of the human world could come together and be shared across both worlds, because that's just not happening. So that's a story. It was probably one of my first One Health experiences, way before I even knew anything about One Health. I mean, that was in the 80s. So a very, very important lesson for all of us. Human-animal bond. We all know that animals can be so wonderful for our human health. And it's a two-way street. We're really good for each other, but we do have to be paying attention. What if your cat or your dog were wandering around in this grass, in this middle slide here in the bottom, and where this sign says warning, tick infected area, and your dog or your cat picked up ticks or fleas and then came and got in bed with you and brought those ticks or fleas to you? And it's just another way of understanding that we share our environment with our animals, and we're living in the same environment. In fact, the American Veterinary Medical Association and the American Pediatric Association actually launched a campaign about Lyme disease that was trying to point out to people that we're living in a shared environment, and if we can pay attention to what's happening and what's coming, seeing how much Lyme disease we're seeing in the animal world, that it can inform the human world. So, excuse me, that shared environment is a really important point. And on the human-animal bond, some of you may be familiar with the 2003 monkeypox outbreak that we had in this country. Monkeypox was not in this country. It came in with some pocket pets. And I'm not really clear if it came in on a legal market or an underground black market, illegal market, because we have a lot of that going on. The CDC had to get involved and had to figure out that that's what was going on, because these monkeypox had gotten into little pocket pets that were being adopted out and bought out of pet stores. We also, most of you will be familiar with the problem of salmonellosis and the little tiny turtles that we used to let children play with. And we also know that bearded dragons and most any reptile can harbor salmonella. So we just need to have habits that keep us safe, keep our hands washed. And surprisingly, even little hedgehogs can have salmonella and can be an issue if, when people adopt hedgehogs. And the CDC has been dealing for a while with Campylobacter outbreak in puppies coming out of pet stores. So, this just behooves us to be paying attention to what might be going on. And it's not just companion animals, it's also large animals. This human-animal bond is very powerful. If you think back to the early 2000s, when over in the UK, there was a foot and mouth outbreak, and not that foot and mouth, this is not hand, foot and mouth disease like people get. It's foot and mouth disease that cloven hoofed animals get. And it's devastating economically when this hits because they have to go in and destroy these hooves, these animals. It is not a zoonotic disease. People don't get the disease itself, but it has a huge impact on people because of the environmental impact. And in this case, we were having to destroy herds that farmers had been, spent their entire lives breeding up this line of dairy cows or this line of Black Angus cows. And we had farmers committing suicide because they were having to watch their animals, their precious animals that they had spent their lives working with, have to be destroyed. So, this is an impactful thing for no matter what, whether it's small animal or large animal. And also on the human-animal bond issue, I would just mention something in passing here. There's a huge link between animal abuse and domestic violence. And we've actually got organizations now trying to help us understand that link and to be sensitive to it. And as veterinarians, we're starting to try to train to, when we see a situation where the animal look like it might be abused or neglected, to realize that the people in those environments may be at the same risk for abuse and neglect. So it's a conversation that has been open. This National Link Coalition has actually made amazing headway getting shelters, domestic violence shelters, to find ways to either take the animals or make plans for the animals, because many people who are in domestic violence situations will not leave their abuser because the abuser has threatened to harm or kill their animal. And so because they know they can't leave, they can't take their animals because the shelters won't take their animals. So many shelters across the US now are starting to make arrangements for pets and to try to help people understand that if they need to get out of a situation, take their pets and get out of the situation. So just to mention another one of these, there's just so many of these kinds of conversations like this that we need to be very definitively having across our sectors. And even non-communicable diseases, non-zoonotic diseases, non-communicable, not even passing between people, diabetes, aflatoxin issues that we deal with. They definitely need a One Health conversation to get all the players and all the knowledge at the table. So I just mentioned it in passing. I hope it might take some time to look at this YouTube video, because we're all very familiar with the walk a hound, lose a pound program that some public health organizations have set up. But this is a wonderful story about a gentleman who was almost 300 pounds overweight, and his doctor told him he better get a burial plot because he was going to need it soon. And he was working with a nutritionist who told him to go to a shelter and adopt an old fat dog. And then both of them, work on trying to get healthy together. And he feels like, and that's exactly what he did. And he feels like Petey saved his life, because it's a beautiful story of how, that human-animal bond was really very life-saving for this gentleman. He became a marathon runner and didn't end up in a burial plot in 6 months. So that's just a wonderful little teaching story for how animals can impact us and us they. So here's another real quick One Health story. This is a true story. It was written by Robert Miller, who's a veterinarian who's written a column for years for a veterinary magazine called Veterinary Medicine. And this is a story about his daughter. This is not his daughter. This is an anonymous image, but it is a story about his daughter who was a travel writer. And so she took a trip to South America and went way up the Amazon, had a wonderful time, climbed a volcano, really went way up the Amazon and got a wonderful story out of her experience. 2 weeks after returning home, though, she was really sick. She had swollen, painful joints and fever and weird skin lesions and, of all things, discolored fingernails. She was having shortness of breath. On radiographs, she had developed lung lesions. And one of the most concerning things they were finding was they were finding some granulomatous visceral lesions along her intestine. So to make a very long story short, 2 years, 76 specialists, and 10 CT scans later, they still only had tentative diagnoses. They thought it might be Hodgkin's or non-Hodgkin's lymphoma or scabies or scleroderma or gastrointestinal stromal tumors, which was probably the most concerning one because of those visceral masses. And so not knowing what was going on, they did eventually schedule her for surgery. But along the way, about that time, her father had gone to a veterinary conference and was telling some colleagues about what was going on with his daughter. And one of them said, oh, she's probably got a vector-borne disease. She needs to take some doxycycline. Another one said, oh, she's probably got a parasitic disease. She needs to take some ivermectin. Somehow they got the doctors to send some blood samples, though, to Dr. Ed Brightsword out at NC State's vector-borne disease and intracellular pathogens research labs. And again, I wish I could ask you to raise your hands and show me what you thought this might be, but I'll just have to tell you what he found was Bartonella vinconii. Now, this particular Bartonella can wreak havoc. It's turning out to be a whole lot more like Lyme disease. And you may know it as the organism of cat scratch disease or even of trench fever. Back in the First World War, they think it was being vectored by body lice for the men in the trenches. And for many years, we thought it was a self-limiting disease, not that big a deal that our immune systems would deal with it. But it turns out it's a stealth pathogen. It climbs into your endothelial cells and into many other cells. It can hide from the immune system. It can be very, very difficult to diagnose. It can there's a different Bartonella for almost every different mammal. It is vectored by very, very many insects. So this particular, we'll spend a couple of minutes here because I think it's a great chance to help us really share some information about an emerging, the significance, the emerging significance and awareness of this pathogen. We've known for years that it's cat scratch fever. It's really passed not by the cat itself, but by the fleas and the flea dirt or the flea poop on the cat that can get into an open wound. Or even from the saliva of a cat. So this is just another thing that we need to be aware of. But back to the story, let's finish the story. She did end up going to surgery and they did go in and look around. And after the surgery, the surgeon came out and said, we didn't see any signs of malignancy. And by that time, her dad had gotten the results from Dr. Brightsword's lab. And he said, you know, I never really thought she had a malignancy. I think she has Bartonella. And the surgeon looked at him and said, well, I'm a surgeon. I don't know what Bartonella is. And this is not bad on the surgeon. None of us can know everything. And the surgeons have to know a lot to be good surgeons. But it is a pointed reminder of how we need better ways to exchange information across professions. What if the radiologist reading her CT scans and her radiographs early on in this story had known not only of her travel history, because they were having trouble putting together what they were seeing with her travel history, had known her travel history and had known that this organism could cause these kinds of lesions, they could have gotten to a diagnosis a year and a half, 2 years earlier. Just think of the money factor, the ka-ching factor of how many dollars on healthcare could have been saved, not to mention the mental anguish and what this young woman had to go through before she got a diagnosis. To figure out what was really going on with her. Now, this particular Bartonella is vectored by dog ticks. And so she at some point had come in contact with a brown dog tick, and she didn't know it. So this is another chance for me to tell you a really great story about a veterinarian and an MD who really developed that working relationship that I have mentioned that is so incredibly needed. Dr. Mosiani became aware of Dr. Brightsword's work on Bartonella and reached out to him, and they literally decided to do a study where he was going to send, and he was a rheumatologist, and he would see people who thought they had had Lyme disease and had been treated but hadn't gotten better, or people who thought they had rheumatoid arthritis, any of the chronic inflammatory processes, chronic fatigue, fibromyalgia, a lot of the things that people were being diagnosed with. So I hope you're sitting down, because after collecting about 296 serum or blood from 296 patients, they stopped to see what they had. 62% of those patients had antibodies to Bartonella henselae, cholerae, or Vinsonii. And 41% of those 296 actually had active Bartonella bacteremia, active organism. And once he got them on a proper therapy, many of them did not have rheumatoid arthritis. They just had an undiagnosed Bartonella infection, because Bartonella was not on the radar for so many people. So I find it really, so many publications now coming up. They're finding now even that this is a situation in blood donors, blood donor situations, and we're really needing to be screened for that. It can have neurologic manifestations. It's very similar to Lyme disease. It's very much a high risk problem for animal workers, especially veterinarians. And one of the most fascinating things to me is this panel on the right here, these red dots. That's Bartonella, the organism itself, lighting up in the bone matrix of the femoral head that was harvested from this this artificial hip, this hip transplant that this veterinarian had to go through because of degenerative arthritis for unknown reasons. And so this organism had been around in this person for a long time to get so embedded even in the bone matrix. This is a very much an emerging story of the human health. And this young lady is one of my colleagues. Actually, she's actually become a huge One Health proponent because she's a school teacher. And when her son was about 11, he got deathly ill for no apparent reason. I mean, he was a healthy, active, athletic 11-year-old. And over a period of a month or so, he went from running track to a wheelchair to a hospital bed, and nobody could figure out why. And finally, he had a weird rash, and she really pursued it and ended up discovering that the kind of rash he had, Bartonellosis, can make a really strange kind of a stria, almost looks like stretch marks rash on people when they have it sometimes. And she found her way to Dr. Brightswort and Dr. Mosiani, and her son he survived. Not everybody is so lucky. One of her colleagues, another teacher, actually lost her son at the age of 26. They knew he had Lyme and they'd been treating for Lyme, but they found out toward the end of his life, too late to save him, that he also had Bartonella. So these are just some really significant and scary stories. I'll mention this one also in case any of you are not aware. Gone in a Heartbeat is a book that was written by a wonderful, wonderful colleague, Neil Spector, an MD, who was right here in North Carolina over at Duke. He was a cancer researcher, and he went undiagnosed with undiagnosed Lyme disease for over 10 years, and it damaged his heart so much that he ended up having to have a heart transplant. And we lost Neil back in 2020, I think it was, and it wasn't COVID. So he was in the medical system and knew how to work the medical system to try to get the very best care, and this happened to him. He was not bitter about it, but he realized that there's so much that we need to be talking about and sharing information across these health sectors. So he became a huge One Health proponent and was actually working with Dr. Ed Brightswort on some research. And they had started focusing on, there's a huge question mark now as to just how much Bartonella might be involved in cancer. So there are some research protocols in place now looking for that connection and that association. So I love talking to an audience like you guys, because these stories will matter even more to you than some of the lay audiences that I talk to. Vector-borne diseases, this is such an incredibly important conversation in the One Health space, all the way from anaplasmosis and babesiosis to West Nile and Zika, and all the Bartonellas and Borrelias, and Leishmania is one that kills more people around the world than rabies every year, and we don't hear much discussion about it. And there's so much that we need to be doing about this Leishmania, that called the Black Death. It's in some countries, it's what people fear most for their children, is developing systemic Leishmania. So This is a huge, huge part of the conversation. And this is almost where the interconnections of the interconnections jump out at you, because this is where, if we're paying attention to the sentinel situation and what's going on with the animals from the Lyme disease and the vector-borne disease front, that we can really use it to inform how we need to develop our rule out list for the human health front. And if we would just pay attention to things like the maps that the Companion Animal Parasite Council have developed for the dogs that we're finding antibodies to Lyme disease. Many of you may be aware that in the veterinary practices, when we do heartworm tests, we have these wonderful little like multi-test snap tests that can also pick up antibodies for Lyme disease and Ehrlichia. And if we actually take that data and overlay it over the data that CDC developed for Lyme disease, look at this. If we can pay attention to what's going on in the animal world, it can inform how we handle things in the human health world. So just another one of those things to be thinking about. Unfortunately, if we're not paying attention, we will end up letting humans be the sentinels for what we're being exposed to, whether it be vector-borne diseases or polybrominated diphenyl ethers or PFAS. We will end up letting the humans be the ones, and we'll have the bodies in the morgue before we figure out what's going on. So it's an incredibly important thing. Don't know how that slide got there. And then back to zoonotic diseases, let's just end up on that. Look at what we've been experiencing now since March of 2020. It has been devastating to watch this map evolve and to see these mass graves. In our lifetimes, none of us had seen mass graves in New York. And to realize that we cannot blame the pangolin or any other animal, that, this is really, all these human behaviors are what are putting us at risk it's not the animal's fault. It's not the virus's fault. The viruses are just taking advantage of the situations that we present, whether it's deforestation and forcing people to live in closer proximity to animals because we're having to raise so much more food for people, or whether it's like these wet markets where we cram a lot of live animals together. And just for fun, I'll just mention to you that we did create a COVID-19 and One Health webpage where you can go and see a lot of discussion about One Health and this pandemic that we're living in. Actually, I need to update this slide. Over 350 articles. These are popular media articles, and we started pulling those because that's what the public is reading, and it's a public that really needs to help us start understanding this what One Health is really all about. So these are articles from all over the world, making the point that nature is not the enemy. We've seen the enemy, and it's often us, and that this is a human animal environment triumvirate. It's our use of land, our use of spaces, the way we live in spaces, the way we're raising our food. One of the reasons the food sector is so important is we've got to find ways to feed almost 10 billion people in the next 50 years without further destroying our environment and unleashing diseases on us. And now we know we've got COVID and deer all over the US and Canada. And of course, the concern is this going to become an incubator, a place where the SARS-CoV-2 virus can mutate and then jump back to people. We've already seen a couple of jump backs to people. We saw that in mink over in the Netherlands. They were destroying mink herds because it was actually jumping into the mink and then back to the people. And of course, the real concern is the mutation. And now, of course, we're dealing with yet another mutation. The SARS-CoV BA4 is now really showing up. And we know that it's going to hit the US. It's showing up in other parts of the world. And there have been some pretty heavy hitters for years talking about how we are not ready. We don't have systems in place to really have our federal agencies work together and be prepared to function together and to put practices and regulations and systems in place that would protect us. So maybe it's the economic factor that will help us realize the need for this. There are so many publications out there about how this One Health approach and practice can save incredible amounts of money, not to mention untold lives. So things there, and I'll stop and go back. Many people don't realize that AIDS, since it hit us in the 80s, has cost the global economy $563 billion with a B. And It didn't have to. And just like COVID didn't have to be what it is now. So, we just really need to be paying attention. Maybe it's the money that will help us realize the need to fully implement this One Health approach at all levels of society, of research, of academia, of the corporate world, of government and public policy, to put all these systems and these in place. So what can we do? We all, I'm hoping that you're all agreeing with me that we need to do something. There is a global One Health movement going on. This is a map of organizations all around the world that are trying to help us further this One Health conversation. We launched a One Health Day, an International One Health Day back in 2016 that has been phenomenal to watch people leading these events all over the world, even during the pandemic when they were forced online, to really educate about One Health and One Health issues. We've got conversations at the G7 and the G20 about One Health, about implementing One Health, incorporating One Health. We have a One Health high-level expert panel that I mentioned to you that the United Nations has helped stand up. We have organizations like PAHO and WHO are very much writing One Health policy statements. There's so much of it going on. I won't stop and talk about it. We've done discussions about One Health at the G20. Last year at the World Health Summit, there were 6 One Health sessions. If you want to go back and look at those, you can see all the discussions about One Health at the World Health Summit. Here in the US, our CDC has developed a One Health office. It's doing wonderful things to help raise awareness and educate about One Health. And in fact, for this audience, I would like to make you aware of their Zoho call, because you might want to tune in at 2 or 3 o'clock on Eastern on Wednesday afternoons. There's an open Zoho call where they're talking about a lot of these zoonotic diseases. So this is a Zoonotic One Health updates call for healthcare practitioners. Having said that, I want you to understand that we do have a One Health office at CDC. We have a One Health initiative now across FDA. Our EPA has a One Health community of practice. Our USGS tries to function in a One Health way, but we have no line item budget anything for One Health, and our agencies are not structured in a way to be able to easily work together or share resources together. So we have a long way to go to really fully implement it, but there are wonderful things happening, and I wanted you to be aware, especially of the Zoho calls. Huge organizations like APHA and AVMA are starting to embrace one, or AVMA has actually been embracing One Health since early on. It was one of the driving forces back in the early 2000s. And many public health departments around the US are starting to do One Health initiatives and One Health programs and outreach in a One Health way, where they get the animal health practitioners and human health and public health practitioners together in conversations. We have launched, the One Health Commission has launched some One Health educational resources for public health practitioners. Many states are adopting One Health Month or One Health Day. And actually, that's another way of raising awareness. New Jersey has just legislated a One Health task force that's forming up in New Jersey. It's the first state in the US to legislate, to create a law saying we will have a One Health task force that will make these conversations happen. We've launched a One Health Awareness Month for January. And we're doing everything we can think of to help raise awareness of the need for this conversation here at the One Health Commission. We work to connect One Health stakeholders, to educate about One Health and One Health issues. And we work very hard to nurture the next generation of leaders. I'll just quickly make you aware of our international One Health listserv and we share international One Health happenings, things that are going on in the One Health space all around the world. Would love to have you join us in that because it's fascinating. We did identify a gap that nobody was teaching children and parents that bats could have rabies. So we have a team that's been trying to do things to raise awareness. We don't need to be afraid of bats. We need bats. Bats are incredibly important in our ecosystem for eating insects. They're wonderful and fascinating creatures. We do need to protect them, but we need to be aware and teach children not to touch a bat if they see a bat on the ground. So things like that, we realize also that this whole One Health conversation isn't, those of us in the life sciences, those of us trained in biology and physiology, like you, my MD colleagues and I, we don't have all the answers. Many of these things require the behaviorists and the psychologists. So we have a group that's actually working to bring more of those social science discussions in, the economist, the anthropologist into the conversation and raise awareness about our issues that we can all work together on. And then I always have to point this out. If you're ever in DC, get over to the Smithsonian Museum. At least you've got until like November of 2023. Back in 2018, they had launched this. That's right. It was 2018. They launched this outbreak exhibit focused on One Health and zoonotic diseases. And it is a fascinating, fascinating exhibit. It starts out with the 2018 flu pandemic and walks the public through all the influenzas and HIV/AIDS and SARS and MERS and Nipah and Zika, and now they're preparing one on Corona. And the reason I'm telling you this is if you can't get to DC, this exhibit travels. So you're more than welcome to bring this to a hospital lobby or a library near you, and would love to see more people aware of this. And it's going all over the world. It's traveled all over the world. So I see I didn't get the slide in here that has the links to connect you with that. Maybe I'll try to include that in the PDF that I give to Invisible. So what can you do as a human health practitioner? One of the most important things you can do is get on your patient intake forms the question about pets and animals. Do you have pets? Do you work with animals? What are the pets? What is your exposure? Do you sleep with your pets? Are your pets current on their vaccinations? These are the kinds of questions that can give you so much information as you're trying to diagnose an issue for any patient that is sitting in front of you. You know, what are their occupational health risks, exposures? What are they being exposed to at work or at home? Be cognizant of some of these parasitic and zoonotic infections that might have been missed, or that, you know, you probably didn't get taught a whole lot about them. Just keep trying to learn more and interact with the professionals that might be able to tell you more. Things like ringworm and Sarcoptes and Cryptosporidia, things that, many of you are probably familiar with visceral larval migrans, but just really start trying to develop and cultivate those conversations. Teach your colleagues and children and patients about rabies every chance you get. Help people understand the value and the incredible power of the human-animal bond, but to be sure that they're being, they have habits that will keep them healthy. And sometimes you can use that human-animal bond to really help your own patient. If you tell a patient who's smoking themselves to death, and they've got a beloved dog or a parakeet, that smoke is killing their dog or hurting their dog, sometimes they'll stop for the pet when they won't stop for themselves. So use this human-animal bond, the power of it, use it to the benefit of the patient. The same thing for the obesity issues, like I was mentioning with Eric and Petey in that YouTube video. And eat less meat. I'm a meat eater. I think expecting the world to stop eating meat is unrealistic. Meat is a powerful source of nutrients, but we can all eat less meat. At least in the U.S., in the Western Hemisphere, we can probably all eat less meat. So have that conversation with your patients if you have the opportunity. Seek out current and expanded information about zoonotic diseases and vector-borne diseases. Try to find some of the most current information, like this emerging information about the significance of Bartonella in humans. Look for those relationships that you can develop locally with your veterinarians or your public health workers or your environmental health workers or your animal control workers. Consider going to try, this is a really strange, but consider going to a veterinary conference or an environmental health conference and look for those overlaps for those health issues that might be significant in your own practice. And then to really help us prevent the next coronavirus or the next pandemic, help us get our lawmakers to understand, and the policymakers to understand the significant need for putting a system in place to do, to be watching for what diseases might be coming out of the wildlife and out of the pets. And then become a One Health champion. There are just so many things that, now that you've listened to this hour of me tell you about One Health, I hope that you'll really understand that there is a critical part for you as a human healthcare practitioner to play here. And I really appreciate your listening as I talked about the full scope of One Health and gave examples of cross-professional collaborations and why it's so important for you as a healthcare practitioner, and that you really understand the need for these collaborations across professions and look to create those, because One Health really is a very powerful solution for many of today's challenges. So I thank you very, very much for listening. And I hope that perhaps we'll get to meet in real life at some point. Thank you very much.